obvious as a nation, we don't lack food. But what isn't obvious is we're suffering from malnutrition. We're suffering from deficiencies. We're eating foods that are killing us. It's causing disease. It's contributing to all the major causes of disease, which is heart disease, cancer, diabetes, and now the new term is metabolic syndrome. If you're not familiar with that, I would urge you to look that up because most Americans today suffer from metabolic syndrome. We as a country need to do healthcare reform, but we need to start in our own homes. We need to start buying better foods. We need to demand better foods in our schools. We need to take what Jamie Oliver is trying to change here and run with it as a country. This man cannot do it on his own. He needs our help. He doesn't have to be here. He could be at home back in England with his children. Subclinical deficiencies, even in athletes at a young age, at 17, where they're lacking in at least 7 major nutrients in their body. And not only are they lacking in those, there's another 5 or 6 that they're actually borderline deficient. We're suffering from malnutrition even though we're eating food because we're not eating nutrient-dense food. We need to change our approach. We need to change our approach to healthcare by doing things that actually change your health. They'll change your weight. They'll change the way you feel. You want your kid, we all want our kids to do well in school. Well, how can they do well in school eating some of the sugar cereals and foods and the simple carbohydrates that we're loading them up on? Why do we have to give our children these foods? Don't make those choices available. I used to say this phrase to family members when they'd say, oh, I can't get my child to eat this or eat that. I said, well, I've never seen a kid go longer than 3 days without eating. And what I meant by that was I wasn't being cruel, but you know what? If the food's not there, they can't eat it. And eventually, if the choices to eat good food are the only foods that are there, those are the things that they're going to eat. And to think that they won't change the rest of their life, that's not true. I have 4 children. My oldest is 19. He eats a better diet than most American adults will ever eat. It started when he was a baby. It started when he was young. The food choices weren't there. We just didn't have it in the house. We didn't deprive him. We cared about him. And because of it, he's a healthy kid today. 19 years old, no drugs in his body other than Novocaine for sutures. That's a pretty incredible thing. But the thing is not only is he healthy, imagine the money we've saved on medications over 19 years. Not one medication. You want to reform healthcare? That's the way to reform it. Take charge of your health. You'll save money in medication. That food isn't any more expensive. It's actually cheaper because in the long run you save money in medication. I'm not saying medications aren't there for a purpose, but the problem is that we're medicating ourselves due to poor dietary. PintoHealthcare.com. Go to Jamie Oliver's website, jamieoliver.com. You can visit us on Facebook at Pinto Wellness Center or ACG Chicago. So if there's anything we can do, don't hesitate to ask us.